Hi, I'm Mallory, and today we are going to be demonstrating the insertion of an NG tube. So first thing I want to do is check my order, check my MAR, identify my patient. So I've done that. We've got the right patient. Next thing I'm going to do is gather all my supplies. So I have my NG tube. I've got a drink for my patient, an emesis basin, hand sanitizer, tape, lubricant, skin prep, pen light, tongue depressor, a chuck pad, gloves, and tissues. And then I have some tape prepared already for my NG tube. So I'm going to go ahead and enter the patient's room. So hi, Mr. Smith. My name's Mallory. I'm going to be your student nurse today, and I'm going to be inserting your NG tube to help with that nausea and vomiting. Is that okay?
Absolutely.
Okay. So, Mr. Smith, can I get your full name and date of birth, please?
John Smith, 3/6/1968.
Thank you. And just make sure that matches the ID band as well as the MAR. And then do you have any allergies?
I do not.
Okay, perfect. So I'll go ahead and set this down. And I'm going to go ahead and provide some time to wash my hands. All right, Mr. Smith, so I'm going to hand you a couple of things. I have a little emesis basin in case you do feel the urge to vomit while we're doing this. It is going to be a little bit uncomfortable. And then during the procedure, I'm going to have you take a few sips of water, so I'm going to give that to you as well. And I'll let you know when to sip on some water. So first thing I'm going to do is open up my tongue depressor. Get that out. And I'm just going to check his gag reflex. So I'll have him open up. And his gag reflex is good. Gag reflex is good, so we know we're good to give him water. Next thing I'm going to do is just take a look at his nares here. So I'm going to have you tilt your head back. And I'm just taking a look to make sure that we don't have any major occlusions. And then I'm going to block off one nostril and have him breathe through the other, and then swap and do it with the other nostril. And we want to choose the nostril that has the best airflow. So in this case, we're going to use his right nostril. So I'll go ahead and prep my tubing here. And we have this specific size based on an adult patient, but if we did have a child patient, we could use a smaller tube for sure. We might also want to have somebody in here to help distract the child. So I will wash my hands. And put on gloves. And we also want to make sure that we check the wall suction. So for an adult patient, the proper setting is between 80 and 120, and we have it set at 100. And here, I'll show it to you on the camera. We have it set at 100. And we want to make sure we have that readily available too. So we have our tubing out. First thing I want to do though is put some skin prep on our patient's nose. So Mr. Smith, this is just skin prep. It's going to help protect your skin from the tape that we're going to have to use to secure it. So we'll do that. So now that we have the skin prep on, while we're waiting for it to dry, we're going to go ahead and measure. So we're going to start with the insertion point of the tube at his nair, and we're going to go down to his ear. And then we're going to pull this down to his xiphoid process. And once we have that spot, we are going to mark it with a piece of tape. And this will give us a pretty good idea of how far the tube will need to be inserted to be into the right location. So once we have that, we can go ahead and begin our insertion. So once again, Mr. Smith, you have your emesis basin here and a drink of water. So, and I'll tell you when to swallow. So first we're gonna have him tilt his head back, placing the tube along the floor of the nostril, and we're going to begin insertion. And we're gonna be watching the oropharynx. Once we see it hit the oropharynx, we'll have him tilt his head forward. And Mr. Smith, this is when I'm gonna have you take a few sips of water, okay? And he'll take a sip of water and we'll insert about 5 to 10 centimeters with each sip of water. And keep going. Just hang in there. I know it's uncomfortable. Perfect. So once we have it in, he can relax his head and holding it in place, making sure not to let go. We will grab our other piece of tape and we're going to place it on the nose using our little appendages here to wrap around the tubing. And have it secured. Perfect. You did a great job, Mr. Smith.
Thank you.
So we'll go ahead and clean up or dispose of any of our supplies here. And a few things to note. So we do want to be checking this every 4 hours. We want to check the placement. So we're going to monitor this piece of tape that we put here, make sure that it's not moving around, that it's where we put it. Also, we want to have a chest x-ray done to make sure that the placement is correct. You can also check placement with the visual, like visualizing the contents that are coming out. You can do a pH strip with any aspirate, and you can do a respiratory assessment. All those things will help gauge placement. Once we have the results of the chest x-ray back, we can hook them up to suction. So we have it set, like I showed you before, on 100 low intermittent suction. So we can go ahead and connect that. Perfect. And then we can remove this. And once again, disposing of all of our supplies in the proper area. Take my gloves off, wash my hands. And I want to make sure that provide for safety and comfort. So make sure the bed is in a low position. We can move him back out of high Fowler's position at this point if he chooses. Make sure his call light's within reach, and we would go ahead and document. So we want to document date and time of insertion. We want the size and type of the tube that we used. We'd also want to document how he tolerated the process, any assessment findings, and I think that's it. And that's how you insert an NG tube.